Hello, my name is Alex Boxberger and I'm a senior psychology major. Under the guidance of Jackie O'Brien and Dr. Maureen Zalewski, I researched the associations of maternal borderline personality disorder symptoms with parenting stress, maternal warmth, and child externalizing problems. Borderline personality disorder, or BPD, affects roughly 6 million women in the United States, many of whom may be mothers. Common symptoms of this disorder include impulsivity, negative affect, and instability of emotional responses and interpersonal relationships. In many cases, the most severe phase of BPD symptoms coincides with childbearing years. When combined with the variety of risk factors that mothers with BPD are frequently exposed to, such as depression, substance abuse, and low support, it is unsurprising that mothers with BPD often report higher levels of parenting stress, which can be thought of as a negative reaction to the normal responsibilities that come with being a parent, leaving them feeling tired, frustrated, or confused. In addition to higher levels of parenting stress, mothers with symptoms of BPD often have interactions with their children that are characterized by lower levels of warmth. This can manifest as invalidating responses, coercive behaviors, or harsh punishment. Unfortunately, both high levels of parenting stress and low levels of maternal warmth have been associated with higher levels of child externalizing behaviors. These include aggression, conduct problems, hyperactivity, and attention problems. Externalizing behaviors have been shown to be predictive of poor mental health outcomes, so it is important to understand the pathways of influence leading to their development. Our study aimed to further understand how maternal BPD symptoms are associated with child externalizing problems and if this relationship might be mediated by levels of parenting stress and maternal warmth. We hypothesized that elevated levels of BPD symptoms would be associated with higher levels of parenting stress, lower levels of warmth, and higher levels of externalizing problems in their children. We also hypothesized that there would be an indirect pathway, such that elevated levels of maternal BPD symptoms would be associated with child behavior problems through their influence on parenting stress and warmth. The study used a sample of 68 mother preschooler dyads, where mothers with BPD symptoms were oversampled. Within this sample, we assessed maternal BPD symptoms using the Personality Assessment Inventory Borderline Subscale. Scores ranged from 0 to 56, and our mean score was 22.12. The community average is 18 and the clinical cutoff is 38, so our sample represents a non-clinical level of BPD symptoms on average, but with a large range included. We measured parenting stress using the Parental Stress Scale. The mean score was 38.78, which is a normative level of parenting stress. Child externalizing behaviors were assessed via maternal report on the Child Behavior Checklist Externalizing Subscale. The mean score was 16.28, indicating non-clinical levels of externalizing problems on average. And finally, we measured maternal warmth using observer ratings of positive affect and interactiveness during a short task where the mother was verbally coaching her child on constructing a difficult figure out of Legos. Positive affect related to displays of happiness, comfort, and connection with her child, and interactiveness related to verbal and nonverbal engagement with her child. Moving on to results. To analyze the associations between these variables, we first conducted a series of parallel regression analyses with household income and child age as significant covariates. The results of these analyses supported that elevated levels of maternal BPD symptoms were associated with higher levels of parenting stress. This was what we had expected. However, we also found that even when struggling with their own mental health issues and stress, elevated levels of maternal BPD symptoms were not associated with significantly lower levels of warmth towards their children. While this did not support our hypothesis, it is definitely a positive finding in terms of child outcomes. We also found a significant association between elevated levels of BPD symptoms and child externalizing problems, as well as between higher levels of parenting stress and child externalizing problems. Finally, we used a bias-corrected bootstrapping method to analyze the indirect pathway of elevated BPD symptoms on child externalizing problems mediated by parenting stress. However, even though each of the direct pathways involved were significant, the indirect pathway was not. This is represented in the image on the slide. This means that there may be some other pathway through which elevated BPD symptoms are associated with externalizing problems, but it is not through their association with parenting stress. In conclusion, elevated maternal BPD symptoms are associated with higher levels of parenting stress and with higher levels of externalizing problems in their children. However, the indirect pathway through these variables is unknown. This information could inform future treatment interventions by allowing them to focus on mother's BPD symptoms or child's behaviors directly instead of on parenting style, and in this way help clinicians, mothers with BPD, and their children. Thank you.